Okay, so thanks everybody for coming on to our webinar series. We're going to do a brief little introduction first, and then we're going to go through the actual webinar. So there's going to be two people presenting. Myself, Paul Scallon, so I'm one of the IPRS Health clinical lead physiotherapists, and also my colleague here, Ashley. Ashley, you want to give an introduction to yourself there?
Yeah, so I'm Ash James. I've been with IPRS for the last year now. I'm the clinical lead for the north of England and Scotland, and I've previously worked in professional sport and private practice here and there. So that's me.
And I'm pretty similar, so I've worked for 3 years at IPRS Health here, a combination of NHS and private practice work, and doing a lot of training to occupational health physiotherapy at the moment. So what we're going to do is, let me just show you where we are here. Okay, so the first thing we just want to say is what we're going to do is, if we can, if you guys are on social media at all, what we want to do is we want to get any feedback or any questions that you have on our Twitter. So please, by all means, get your phones out now if you can, and if you just type into us at IPRS Health on our Twitter account. You can ask us any questions on the IPRS Health Twitter account, so just type in your question, or if you've any feedback during the webinar or after the webinar, that'd be fantastic. And what we'll do is at the end of the webinar, we will we'll answer any questions that you might have. Just in regards to the questions, we can't answer individual questions on specific conditions. We can give overall advice on in general. So we can't answer specific issues on an individual basis. Okay. Also, in the tweet, if you can just hashtag IPRS Health webinars as part of your tweets, and then just ask your question or provide your feedback, that would be really appreciated. So, we're also going to do a poll, which we're also doing on Twitter. So, if you're on Twitter, we have a poll running now, and the poll is this question, which we will answer at a later stage. So, the question is, surgery is always the best option for rotator cuff pain at the shoulder. And all we want to do is, in your own opinion, it's not a test or anything, in your own opinion, is that true or is it false? So if you go to IPRS Health Twitter account, you'll see that poll, and if you can just answer that, and we'll provide the answer towards the end of this webinar. So what we're going to have a quick run through today is we're going to go through basic anatomy, so it's good to understand what's happening in the shoulder and how it's happening. We're going to run through the prevalence of shoulder pain within the UK. We're also going to go through the risk factors associated with shoulder pain. We'll have a run through of common injuries in the shoulder, and we'll also on what you can do in terms of treating shoulder or preventing shoulder pain. Okay, go for Ash.
Yeah, so I just want to give a brief, very small, simple introduction to shoulder anatomy, and I just want to make sure that everyone's familiar with the area we're talking about, so we can have a good idea moving forward. So the shoulder is broken down mainly into 3 bones. So we've got the humerus, which is the arm bone, which is the top of your arm, and that forms the glenohumeral joint, it's called, or the ball and socket joint, with your scapula, which is your shoulder blade. So that's the glenohumeral joint there. And the scapula is a triangular bone that sits on your back, which Paul is kindly outlining for me. And there is your collarbone, or your clavicle, which is the bone at the front here. Now, the shoulder joint is quite unique in that it gives us quite a large range of movement, and that range of movement is allowed because of this ball and socket joint. And one of the things that is important if you have a lot of range of movement is stability. So one of the things that add to the stability of your shoulder is the rotator cuff muscles. There's ligaments and there's other things to add there, but one of the things that we want to concentrate on today are the rotator cuff muscles. So they're made up of 4 muscles. Paul's pointing out now the one he's drawing on at the moment is called your supraspinatus. The one he's drawn on is your teres minor, and there is also the infraspinatus, and they are all on the back and on the top of your shoulder blade. And on the underside of your shoulder blade, so the other side, is a muscle called your subscapularis. And the names aren't necessarily important. The important thing to know is that they all attach at the top of the shoulder there, where Paul's just put an X on. and they add to the stability of your shoulder. So your shoulder joint is something that has a large range of movement, but is also made more stable by the muscles itself.
Perfect. Guys, we've had just a lot of people just coming on just in the past couple of minutes, so you may have missed the start of the presentation. So I'm just going to quickly just remind you that we are on Twitter at the moment. We're live on Twitter, so if you want to ask any questions at all, if you can just go into @ipresshealth.com, and hashtag iPressHealth webinars. You can ask any questions on Twitter, or you can give us any feedback on Twitter, and at the end of the presentation we'll answer any of those questions that we can. Okay. So we've just run through the basic anatomy, so Ash is going to quickly go through just some of the prevalence of shoulder pain.
Yeah, so shoulder pain is actually quite something that a lot of people have. It's quite common. So it's the third most common cause of MSK injury in the UK. I'm going to click onto the next point, Paul. So there's a self-reported prevalence between 16 and 26%. So what that means is that percentage of people are self-reporting that pain to their physios or their GPs. But only 1% of adults with new shoulder pain consult their GP each year. So only 1% of those people that report with shoulder pain are reporting it to their GP. Which is quite an interesting fact. Yeah.
I think what that really emphasizes is that early intervention of really getting in at an early stage as you can with when you have shoulder pain is so important, which just highlights we're not doing to a certain degree. I'm going to quickly run through some of the risk factors. A lot of you might know already; they're kind of commonly known. So we have a lot of different risk factors, and one of the most commonly known ones is your repetitive movements. So a lot of jobs are involved that we have in that do involve repetitive movement, and that's work that requires moving the same muscle group in the same direction over a prolonged period of time, and with minimal rest. So some of your jobs that fall into repetitive movement will be working on assembly lines and production plants, you know, working in front of a PC, using your mouse repetitively with minimal rest in between. It can vary between different jobs, and it certainly can load the shoulder joint and irritate the shoulder. One that's probably not as well known, and this covers shoulder pain and a lot of other type of musculoskeletal pain, would be low job autonomy. So that would be somebody who doesn't have much control over what they do in their job. So again, going back to somebody who's working maybe in a factory on a production line, and they're just doing the same activities over and over, and they can't stop or change their tasks as much as they want to. A good evidence behind weak communication or poor employee support or poor employer support. So if there's any issues with your fellow work colleagues, or if you have any issues with your manager and you don't feel like you have that support, that certainly has a lot of evidence behind it to affect musculoskeletal pain. Some of the other ones would be overhead work. So, you know, working overhead is not in itself a risk factor, but it's how you work in overheads, and it kind of goes into repetitive movement. So, you know, working above shoulder height in an awkward position with minimal rest in between, or lifting a certain amount of weights in that height position, generally is considered as a risk factor. Vibration, a lot of jobs, construction workers, people again working in factories or production lines would have to work with handheld tools, and that is a risk factor, and it can lead to something called hand and vibration syndrome, which really is a numbness of the fingers or white appearance of the fingertips, and it's really important for the employer to make sure that they're regularly maintaining the handheld equipment to prevent any of those risk factors. The other one's heavy lifting. So there's a big incidence of shoulder pain within the construction industry, and also related to heavy lifting with that job. So the HSE guidelines is a guidance. It's not a legal document as such, and it's just to tell you that the recommendation would be for men to not lift beyond 25 kilograms from waist heights, and for women not to lift beyond 16 kilograms from waist heights. And then if it goes overhead, obviously you want to reduce that weight. So the HSE guidelines is not to lift over 10 kg in men and over 7 kg in women. So just trying to keep within those guidance recommendations to reduce that risk, really. The other one's psychosocial factors. A huge issue with shoulder pain and with musculoskeletal pain, and that would relate to stress in the workplace, anxiety, low moods. If you feel have avoiding your movement, so if you feel you have shoulder pain and you're avoiding to move it because you don't want to make the pain worse over a long period of time, that can certainly have a negative impact. And also what we call some catastrophization. So if you feel that there's something more sinister going on in your shoulder, that can also have a negative impact on your pain. And finally, not work specific, but definitely related and can affect your work, is recreational hobbies and sports. So your weekend warriors who go out and train a lot on the weekend, maybe do some overhead activities or work in a gym, and kind of overload the shoulder and certainly increase the risk of shoulder pain.
So I'm just going to go on to talk about the most common causes of shoulder pain and how they manifest themselves. So if you could put them up there, Paul. And these sound, you know, quite medical terms, so we'll break them down a little bit. So we've talked about the rotator cuff. So if we think about they're the muscles that help to stabilize the shoulder. And obviously for all those risk factors that Paul's just discussed, sometimes they can get injured. Glenohumeral joint disorders, so that's the ball and socket joint we talked about, so that's where the top of the arm attaches to the scapula, making the shoulder joint. So they tend to be injuries that are caused by more traumatic events, so falling or tripping, or, you know, as Paul said, the weekend warriors that might play rugby or football and they fall on their shoulder. That's how they can get caused. There's also, similarly, the acromioclavicular joint injury. So that sounds like a big medical term. It's the AC joint, which is located just at the top of your shoulder and the tip of your shoulder. And that, again, can be caused by landing or falling on your shoulder. And you can also get, if you're in your latter years, you can get arthritic changes in that joint as well. And then lastly, referred pain from the neck is also quite common. So if you're someone who's had neck pain in the past or has bouts of neck pain, you can sometimes feel that the pain goes down into the shoulder, and it can feel like shoulder pain when actually it's more likely coming from the neck. So they're the four main common causes of shoulder pain from those risk factors that we've discussed. So if you're exposed to any of those risk factors, then the injury that you get will likely fall into one of those four categories.
Right.
So if we think about what the most common injuries are at work that we see, so the most common injury we would see would be rotator cuff related shoulder pain, and that's something we've talked about already. So because of the risk factors that Paul talked about, so the overhead work, repetitive nature of work, relationships between employers and employees, vibration, things like that, those risk factors most commonly contribute towards rotator cuff related shoulder pain. So that's injuries and pain around those muscles that stabilize the shoulder.
So in the workplace, bear in mind we'll ask you to describe what you may hear, or if you've been to a GP or if you've been to a physio or some other health professional, you may have come across some of these medical terms that's related to the shoulder. So you may have heard of an impingement or tendinitis, tendinopathies, or rotator cuff tears. All of these terms are now bridged within this heading. So rotator cuff related pain incorporates all these injuries. So this consists of a large amount of the shoulder pain that we would see as physiotherapists, and certainly as we would see in the workplace. So if you do come across these terms, these are all rotator cuff related pain, and these are all conditions as physios, as health professionals that we certainly can treat.
So I just want to briefly reiterate, again, a point we made before, but talk about some other things that we may not have thought contribute towards this rotator cuff related pain. So Paul's already mentioned that repetitive overhead work can contribute towards this. Sharp increases in load, now that's a big one. So this may occur if you change from your job role to a different job that you're not used to. That involves more lifting. or more overhead work. So any sharp change in load can contribute towards this rotator cuff related shoulder pain, and that's an important thing to remember if you're ever changing jobs or moving jobs. Or it could even be away from work that you suddenly have an increase in load if you decorate over the weekend, or you have to help move, or you just generally are using your shoulder more. That's a good thing to bear in mind.
Yeah, and we do kind of see patients coming into us who've explained that they've had no change in any of activities that could have caused the pain, and that's quite common. And actually, shoulder pain is related to underload as well. So if you've had a change to where maybe you were doing a job or an activity, and then you change to something where you're doing a lot less, was a more sedentary or static activity, that underload can also actually, that change in load can also cause some of your shoulder pain.
Yeah, that's a good point. And closely related to that, obviously, is muscle weakness. So that sharp increase in load occurs, and you may not have the muscle strength to cope with that load, and that manifests itself sometimes as pain. So muscle weakness, if you're not strong enough to cope with the load that you're putting yourself under, that's what can contribute towards pain.
Mm-hmm.
Previous injury is also very common, a common cause. And these last two, I think there's one more, I think, Paul, is there? There's three there. Yeah, so this is something that Paul's touched on as well, but other lifestyle factors can sometimes have a big contributing factor towards shoulder pain. And this isn't just shoulder pain, these can often contribute towards other musculoskeletal issues as well. So smoking, your body weight, and general stresses on your mental health as well can have a big influence on shoulder pain. So it may be the situation where you can't seem to place how you've done it. You don't really work overhead. You don't feel like you've changed your load an awful lot. Your muscle weakness or your muscle strength may not have changed. You might not have had a previous injury. But if you might be a little bit overweight, you might smoke, and then all of a sudden, or a big stress comes in from home or at work, and that manifests itself as pain. So, those things can be equally contributing towards pain as any of the physical things. So it's important to note that if you do have shoulder pain, trying to pinpoint where that's coming from can often really help in approaching and managing the pain.
Yeah, very good. Okay, so so we have the poll online on Twitter at iPress Health. Have we had any votes on that, Ashley?
Yeah, so on Twitter we have a very informed audience, and 100% of people think it's false that surgery isn't always the best option for rotator cuff pain.
So what I'm going to do, just for a bit of interaction, I'm going to put a poll out now, and you just click what you think with this poll, and then what we'll do is we'll run through the answer in a second. So if I just launch this, so you can see there's a poll come up on your screen now, and what we're asking is, in your opinion, is surgery the best option for rotator cuff related pain? So if you can just answer that, and what we'll do is we'll run through what the answer is and the results of this poll in a minute. Getting loads of votes in. Brilliant. And again, this is in your own opinion or what you've heard or what you think. It's not a test. We're not going to test you. All right, so we've got nearly 100% voted. I'm going to wait just another few seconds. Okay, perfect. Right, so this is creeping up. Right, so what we've got here is the opposite, Ash, and it's quite encouraging to see, actually. So the poll is, surgery, is it the best option for rotator cuff pain? And obviously there's a true and false. We have 80% people who voted, so we've got a good 80 people who voted, and 99% of people said that it is false. Perfect. So we're going to go through what it is now. So Ashley's going to run through this with you.
Yeah, so if we think about surgery, it's great that everyone's answered that way, actually, because that is true. It's not always the best option. And what the research has demonstrated lately, over the last 5-10 years, is that supervised structured exercise is as effective as surgery in these rotator cuff related shoulder pain. And that can sound quite surprising because over the years there's a lot of surgery called subacromial decompressions that have been done, and you know a lot of you on the webinar may have had shoulder surgery before and may have even had that particular surgery. Decompression, it's most commonly known as. The phone just flashed up. So yeah, it's quite surprising and nice to know that supervised structured exercise is as effective, and that's even in up to 65% of patients with a subacromial spur. Now, a subacromial spur is just a little bone growth on the bottom of your scapula in and around here. And what it was thought by surgeons was that if that was present, then that would be causing some pain on the rotator cuff because it's around the same area. So they would go in and shave a bit of the bone off, and that would help. But what we know now is even in 65% of those patients, exercise is as effective. And they're doing a really interesting study at the moment. It may have finished at the moment, but they're doing a study where they're going in and doing sham surgery. So what they're doing is they're going in, they're making portal holes, just moving them about a bit, taking them out, and then sewing the person up. So they're not actually doing anything. They're not doing the surgery. And what they're finding in there is those people that have the sham surgery are coming out and having the same results as those who are actually having the surgery. So that's really interesting and brings us back to the psychosocial side of things, where we're thinking about people's mental health and how they view their pain, and the fact that they think they've had surgery is sometimes as effective as the surgery itself. So that's a little interesting study that's moving along at the moment. But the main message from this is that surgery isn't always the answer, and in many cases shouldn't be the answer, and you should always try a conservative approach first before jumping to surgery.
Yeah, exactly. Okay. So I suppose the natural question with most people who have experienced shoulder pain or currently have shoulder pain or want to prevent shoulder pain is what can you do to address it? What does work? And these are the 4 factors that we know for shoulder pain through evidence and through our own clinical experience that do work. And the first one is education and understanding, and what you being on this webinar is part of the education. So it's you understanding about the shoulder, what causes shoulder pain, the risk factors of shoulder pain, and what you can do to change it. That is one of the most important things of understanding shoulder and to help prevent it in the long term. Also, other things have been able to understand about pain itself. So there is a common misconception, especially within the workplace, is that we shouldn't work if we have pain. We should be 100% better before we return back to work or before we go back to normal work duties. And we kind of know that isn't true. So you're not expected to be 100% better and have absolutely no pain to work. Obviously, you want a good improvement. Up to 80% of improving your shoulder pain is generally adequate enough to go back to work. And we know work is a very important part of rehab, particularly for musculoskeletal pain such as shoulder. So returning back to work or going back gradually into your normal duties is an essential part of your rehab. It's also exercise. So as Ashley's previously explained in this slide about surgery, we've got very good evidence behind exercise. And we do a lot of promotion for exercise, which I'll explain later, and we can do general exercise programs for prevention, or obviously depending on your clinical diagnosis as a physio, we prescribe specific bespoke exercise programs to address that problem, and there's fantastic outcomes we have clinically and through research with exercise. Load modification is a really important one, and this especially if you come under that rotator cuff related pain, and this really means that if we know what caused the pain, and it usually is some sort of change in load in a lot of cases, well, therefore we need to change that load. We need to reduce that risk. So modifying what you need to do. So, for example, if you work in a seated desk job, or you work in front of a PC, and you use the mouse on your right hand, and you're using the mouse a huge amount of time, it's very, very repetitive movement, very minimal rest in between, and it's always on that one side, and you have that shoulder pain on your right side. To modify that, you would simply maybe utilize your left hand for the mouse, or you would use an ambidextrous mouse where you can switch between the left and right, and you would break up your movement patterns. You would try to get more rest periods in between, and that's load modification. If you work in a in a line production plant, for example, where you're doing a lot of repetitive movements in the same position. I think communicating with your management and changing your job role a little bit, maybe doing a certain different job for a period of time, and varying your movement will be a load modification and be changing that risk factor as well. So really important, just having to think about that. And your physio will be able to identify what specific modifications you will require if you get an assessment. And the final one is lifestyle change. So we know factors such as obesity is related to shoulder pain, diabetes. There's evidence behind increased shoulder pain, smoking, lack of exercise, just generally looking after yourself, and well-being has a very positive influence on reducing pain in the shoulder and preventing pain.
Okay, so just in conclusion then, to try and bring everything together, so we know shoulder pain is common, particularly in the working population. Common causes: overhead work, lifting, carrying, and poor lifestyle choices. And I think, you know, most of the people on the webinar will maybe have can relate to overhead work or lifting something too heavy and carrying stuff, but it's trying to think about those lifestyle choices as well that might, you know, you might take away from this webinar a little bit more. Surgery may not be as beneficial as we previously thought, and exercise certainly works in place of that. You know, we know it's as effective. So, you know, they're the two main points as well. And lastly, you know, seek advice, seek help if you're not sure. Speak to a physio, have an assessment, and they can guide you through what the correct exercises for you would be. So we can make sure that your shoulder pain starts to reduce. They can give advice on exercise, lifestyle changes, you know, load modification, all those things we've talked about that help. Physio's a prime placement to help with those.
Yeah, and I think what is important as well is identifying, if you have identified risk factors within your workplace that may be causing the pain that we discussed, is communicating with your employer and with your colleagues and seeing, can you improve that communication and maybe get some sort of process to assess those risks. And that's something that as occupational health physios that we can help with if it's something that needs to be addressed. So what we're going to do as part of the webinar, we're going to give it, I suppose, an additional benefit. We are doing a health promotion at the moment for all of our clients within IPRS Health. So it's basically utilising our new IPRS Health app, which is a fantastic app, which provides exercises on your app for free. You get videos, lots of education on it, and it also gives you resource to our website called myiprshealth.com, which gives us free resource to different injuries, videos about injuries, how to manage different injuries, how to manage certain pain issues. So what we're also putting on an exercise program specifically for the shoulder and the elbow for prevention shoulder and elbow pain. So if you are interested in this, it's an 8-week exercise program with all the extra resources on myiprshealth.com. If you email both of us, so my email is paul.scallon@iprsgroup.com, and then Ashley's is ashley.james@iprsgroup.com. Email both of us, and just if you want to request access to this app, and if you can also just give us your year of birth, which we need to enter for the app, and then what we'll do is we'll email you back the details, the link to get the app, and the code, the access code. You'll get an individual access code for the app, and it's a fantastic app. You'll really find a good benefit of it, and loads of additional features on to help improve your experience with exercise at home. So that's something that you can email us for if you want, some additional benefits. Also, guys, we have loads of resources on our website. So we have, at the moment, we've got some blogs on the website. So if you click on the news and blogs section, and then you click onto the working shoulder, so we have a full blog on shoulder. It's quite a clinical blog, so some of it may be hard to read, but we also, if you get the app from us, we also have a patient blog, which is less clinical jargon and as such, and that's on myiprshealth.com in our blog section once you get the app. So again, loads of resources for you to look at, and that's kind of everything. So what we're going to do is we've got a few minutes left to maybe open it out to you guys. So if you're on Twitter, if you just want to ask any question or if you can give any feedback at IPRS Health on Twitter, we'll answer those questions now. You will also have on your toolbar on the right hand side, you will also have a questions box, and you can ask a question in that if you want to as well. But we'll just hold on a few minutes here and see.
It's okay if you can't think of any questions now either. So if you feel like you think of a question over the next couple of days, you can either email it over in that email, or you can ask us on Twitter. Feel free to put something out there, and myself or Paul will get back to you.
Okay, I think I have Adam Lualski. He wants to ask a question here. I'm going to unmute you, Adam. So, do you want to ask a question, Adam?
Hi there. I don't actually have a question. I don't know how that worked. I don't know how that happened. I haven't pressed anything.
No problem, Adam.
If you go to the question sections, Paul, there's a...
Okay, do you know what? But I will ask one since I'm on the spot. So I've got an issue with shoulder pain that I think comes from driving reasonably long distances, because I've got quite a long commute. So this is kind of a repetitive strain style injury. It's very difficult for me to change kind of the driving position that I'm in and the shoulder position that drives that pain. Have you got any top tips on how to deal with that?
Driving's always a problem. We see it a lot with shoulder. So Ashley and myself both have to drive a fair bit for our job as well. And it's kind of goes into that risk factor of, to a certain degree, repetitive movement and static positioning. So it's holding yourself in that seated position with your arm roughly at shoulder height for long periods of time. And that's what's irritating the shoulder in a lot of cases. So some of the best advice is to move and to vary your position. It sounds a bit remedial advice, but it works. So changing positions of your arms. I don't know how safe it is for driving, but change positions of your arms as much as you can, rolling the shoulders around, moving the neck around, and just shifting in the car as much as you can. Can help. And we also sometimes advise not to use too much of an overhand grip on the steering wheel. So maybe to hold you outside the steering wheel, so you're in a neutral grip with your hands, as opposed to an overhand grip at the top of the steering wheel. Ashley, have you got any more?
Yeah, so if we go into the questions, I'll just go into the questions section down here. I know a few. So one of the questions here is, doing exercise makes if doing exercise makes your shoulder hurt, do you keep going through the pain and hope the shoulder will strengthen and then the pain will finally ease? And this is a really good question. I get asked often by patients, if it hurts a little bit when I'm doing the exercises, should I stop doing them? And it depends on a couple of things. So one, it depends on, are you doing the correct exercises? So let's, for instance, assume that the exercises you've been given are appropriate and they're the right exercises that are going to improve you through your pain. Now, the rule I always go to is the scale of 1 to 10. So if we think about 10 being the worst pain imaginable and 0 pain being no pain at all, if your pain ranges between 1 to 3 out of 10 while you're doing the exercises, and it stops as soon as you stop doing the exercise, or doesn't hurt a couple of minutes after you finish doing the exercise, then for me that is an acceptable level of discomfort for when you're doing your shoulder exercises. So it's a little bit painful while you're doing it, that's okay, as long as the pain stops pretty soon after you've finished the exercises. Now, if when you're doing the exercise, the pain creeps up to a 4 or 5 out of 10, and it remains to be a little bit sore for 10, 15, 30 minutes after you finish the exercise, that's probably a little bit too hard. Now, what you can do there is you can either modify the exercise itself, so reduce the amount of reps or sets you're doing, so reduce the load of the exercise, or you can change the exercise itself to something that's a little bit easier, so that's called a regression, so you would make the exercise a little bit easier. But I hope that answers your question. So a little bit of pain can sometimes be okay, and often is okay for me, if it's rotator cuff related shoulder pain, but not too much.
Yeah, perfect. Okay, anybody else? You got your questions tabs to the right side. If you type in a question, it'll come directly to us. We can answer it. Or you've also got your chat section. If you type in the chat, everybody will see the question. So we have, yeah, we do have a question on a medication-related question. Again, we can't really answer any individual specific questions on medication, and that's something what I'd recommend. If you have any, if you're unsure about medication, about how long you should be taking medication, what medication you're taking for your shoulder pain, it's important that you you book in with your GP just to advise them, because the GP is the main person for your recommendations on medication.
So there's a question there as well. What is thoracic outlet syndrome? Now this is something that we wouldn't class as a shoulder issue. Thoracic outlet syndrome is a group of disorders really where either nerves or blood vessels are getting pinched in and around the top of your neck, in between your ribs and your neck there, and that can cause sometimes pins and needles or numbness in your arm. And that would be a separate issue from a shoulder pain. There's specific tests that we as physios would do, or your GP would do, to differentiate between shoulder pain or thoracic outlet syndrome. But my advice would be that if you have any pins and needles or numbness in one or both of your arms, then you should seek advice from your GP or a physio if you have contact with them, and they can advise you on whether you need to get further intervention or investigations. But thoracic outlet syndrome would be something that isn't related to the shoulder necessarily, but you would get symptoms in that area, but it's compression of a nerve or blood vessels. So that's the answer to that question.
We've got another question just about shoulder pain at night. So just asking questions about getting shoulder pain as they sleep, and this is a common one again. And pain at night time can be for a couple of reasons at the shoulder. One of them can be the obvious, is that positional pain. If you have a current irritation of the shoulder and you're lying on that side, or you're lying in an awkward position on that shoulder, it can certainly irritate pain. And it's really about adjusting. It's a difficult one in your sleep, but it's about adjusting your position in bed to reduce the stress placed on that shoulder. What I would say is for that one, it probably needs to be assessed properly. If you get any pain at night time, what I'd recommend is that you get it booked in with your physio. If you have a physio on site or one of our providers. And I would try book down soon as, just so you can get it fully assessed to see what's causing that night pain. It may be very simple, just a positional change related to a current injury that you have. But I would certainly book in with your physio as soon as you can.
Yeah, night pain, if you lie on one side, can be sometimes caused by a bursa. So you've got something called bursa, which is just a little fluid sac in your shoulder. And you can get something called bursitis, where that gets a little bit inflamed, and lying on that can be quite uncomfortable. So it could be that, but it could be one of many things. And without a proper assessment, as Paul said, you should probably get seen by a physio who can give you a bit clearer diagnosis and advice on that.
Yeah.
I think we've answered all the questions there, Paul.
Just somebody's asked for our email address again, so I'm just going to quickly bring up our emails for you if you want to email us for the exercise app. And again, please, if you can, on Twitter @iPressHealth, any feedback just in regards to the webinar, hashtag #iPressHealthWebinars, that'd be fantastic. We appreciate that. Okay, so I think we're going to finish it up. Again, thanks to everybody for attending. We had a great outcome for this webinar, and we will have a few more webinars coming up this year. The next one will be in July on the elbow. So we hope to see you all at that webinar. And if you have any feedback to help us with the webinars in the future, please, by all means, email us as well to help us out. That's it. Thanks a million, guys. Bye-bye.
Thanks, guys. Thank you.